Lolly, 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 let's talk public health, environmental disasters, and nuclear waste disposal. If you're new here, I used to work for the government and I had different jobs within public health, Medicare, and Medicaid, and currently I now work in the private sector with pharmacy data. One of the difficulties with public health is the main focus is more the entire population, and you're not really focused on the nitty gritty of each individual person per se. Conversely, on the other side, you're going to be more concerned with your individual instance, especially if you are trying to survive day to day. This can make working in public health difficult because sometimes the public health officials don't necessarily understand the fear and distrust among people that are affected, especially if they are in lower socioeconomic levels. For example, if there is a major disaster, you need to figure out how to inform the public without causing panic. And since this current regime seems insistent on rolling back regulations for the Environmental Protection Agency and trying to get rid of anything associated with FEMA and whatever else they feel, let's discuss some things in history. Most people are aware of the fallout in Chernobyl in Ukraine, but about a year after that in South America, I don't know how to say that, I don't speak Portuguese. This particular accident occurred in Brazil, and it was because an unsecured radiotherapy source was stolen from an abandoned hospital site and it was open. The reason that the source of the radiation was even found is because the people in charge, politicians, and businesses were all negligent in some way. A radioactive therapy institute got caught up in the middle of paperwork, there was a whole bunch of legal back and forth, and as a result, equipment was left that contained cesium-137. Cesium-137 is a radioactive isotope. Because of everything going on between all the different parties involved, it got to a point where the security people that were in charge of monitoring this building and the equipment basically just kind of not showed up to work one day. Since this was abandoned, a couple people went in and they were trying to look for different materials that they could get money off of. They found this container and then they opened it. The people that opened it didn't know what it was, and so this powder was getting spread around for about 10 days before someone figured it out. Of course, those most heavily affected were those in lower socioeconomic situations, and the health department and the government came in, and they were so heavily focused on containment that they didn't necessarily treat the people affected as well as they could have. Those who were the most heavily affected already had distrust of the government of Brazil for good reason. So now you have a situation where you have public health officials and nuclear physicists that are trying to focus on contamination, while you have people that are angry and scared and don't know what's going on because no one's really telling them anything. If you liked the show Chernobyl and you'd like to know more about this particular incident in Brazil, I recommend the show Radioactive Emergency on Netflix. What I really appreciate about this one is that it shows how powerless and fearful a lot of these people were. It also shows the missteps in how they talked to the public and how they handled people that were affected. From the incident in Chernobyl and the incident in Brazil, protocols have been created with how to handle this in the future. While there are many similarities between the two, there are also a lot of differences. Whereas Chernobyl was a meltdown, the incident in Brazil was prolonged exposure. A more recent event that I remember watching on the news in March 2011 was the Fukushima nuclear accident. Apologies beforehand on my mispronunciation. On 11th of March 2011, a major nuclear accident started at the Fukushima Daiichi nuclear power plant in Kuma, Fukushima, Japan. The direct cause was the earthquake and tsunami, which resulted in electrical grid failure and damaged nearly all of the power plant's backup energy sources. What I want to point out with this incident is what happened after the fallout started. Due to difficulty coordinating with the national government, a 3-kilometer evacuation order of about 6,000 residents and a 10-kilometer shelter-in-place order for 45,000 residents was established nearly simultaneously at 21:23. The evacuation radius was expanded to 10 kilometers at 5:44 and then revised to 20 kilometers at 18:25. The size of these evacuation zones was set for arbitrary reasons at the discretion of bureaucrats rather than nuclear experts. Communication between different authorities was scattered, and at several times the local government learned the status of evacuation via the televised news media. Citizens were informed by radio, trucks with megaphones, and door-to-door visits. Many municipalities independently ordered evacuations ahead of orders from the national government due to loss of communication with authorities. Due to multiple overlapping evacuation orders, many residents had evacuated to areas which would shortly be designated as evacuation areas. This resulted in many residents having to move multiple times until they reached an area outside of the final 20-kilometer evacuation zone. 20% of residents who were within the initial 2-kilometer radius had to evacuate more than 6 times. Inconsistency and constant changes in communication add to fear and panic. The Japanese government felt that the government and TEPCO provided limited information about the accident in the early weeks. Expert analysis of the accident that was understandable to laypersons was not given by the government or TEPCO, but by Masashi Goto, a retired nuclear vessel designer at Toshiba. Feel free to pause and read further, but there was multiple instances where data and information about the accident was not properly handled. The aftermath of things like this happening also affect public health. In the former Soviet Union, many patients with negligible radioactive exposure after the Chernobyl accident displayed extreme anxiety about radiation exposure. They developed many psychosomatic problems, including radiophobia, along with increase in fatalistic alcoholism. As Yamashita noted, we know from Chernobyl that the psychological consequences are enormous. Life expectancy of the evacuees dropped from 65 to 58 years, not because of cancer, but because of depression, alcoholism, and schmierscheid. Relocation is not easy, the stress is very big. We must not only track those problems, but also treat them, otherwise people will feel they are just guinea pigs in our research. Stress often manifests in physical ailments, including behavioral changes such as poor dietary choices, lack of exercise, and sleep deprivation. Survivors, including some who had lost homes, villages, and family members, were found likely to face mental health and physical challenges. Much of the stress came from lack of information and from relocation. Unfortunately, public health policy can be affected by politics and wanting to maintain a certain image. And when that is held above the safety of the general public, we all suffer, and the poor suffer the most. When Poland was behind the Iron Curtain, Jolanta identified lead poisoning that was being leaked by the factory and heavily affecting the kids and the families nearby. Her research and work was suppressed because the politics and egos of the time were more important than trying to protect the health of the community, and as a result, the community had to band together to fight back. The Environmental Protection Agency is supposed to trace PFAS and other contaminants in the environment. Underfunding and understaffing certain agencies within the government in the U.S. has been happening for a long time. However, this current regime is speedrunning, getting rid of everything that they can, and one of those being the EPA. Formosa had been leaking contaminants into the environment in Point Comfort, Texas for a long time, and now ExxonMobil is doing the same thing. It is no secret at this point that the current regime is doing all they can to dismantle things like regulatory agencies and the Department of Education. By underfunding and understaffing them, they make them less effective, and as a result, they can decrease any trust in the government or these agencies. They want people to be fearful and they want them to panic. There are some good people that do work in some of these government positions. And when this regime is out, it's going to be that much harder for them to try and regain trust back from the public. All this to say that there's always room for improvement with public health and the way that they handle dealing with people that are affected. We should also not let fear try to control our actions or the ways that we react to what this regime is doing.